8 years old man complains of long history of shoulder pain and more recently weakness. On examination, active attempts of abduction are impaired, passive movement are normal. What is the most likely diagnosis? That means in case of shoulder abduction, the active movement is lost. So what causes the active movement? We will have to find. Here are the options. Options are rotator cuff tear, osteoarthritis, metastatic malignancy, adhesive capsulitis, calcific tendinitis. First of all, let's see the abduction. First, 0 to 15 degree. 0 to 15 degree, the abduction is done by the supraspinatus muscle. This is supraspinatus muscle. And from 15 to 90 degree, it is done by the deltoid. And above 90 degree, the abduction is done by the trapezius. So these are the muscles: supraspinatus, deltoid, and trapezius. Here the active abduction is lost. That's been supraspinatus, deltoid, or trapezius. There, any of them lost. And actually, the active attempts, that means the initiation, and initiation is done by the supraspinatus. So there is chance of injury to supraspinatus muscle or tendon. So first of all, let's see the rotator cuff. What is the rotator cuff muscle? The rotator cuff muscle is formed by the supraspinatus, infraspinatus, teres minor, and subscapularis. So they form the rotator cuff muscle. So what's occur in case of the when there is loss of abduction? It is caused by the tearing of the supraspinatus tendon. Here you can see this is the tendon is the supraspinatus tendon, and it causes initiation of the shoulder abduction or attempts to shoulder abduction. So when there is tearing of this tendon, what occurs? Here we can see this is the rupture or tearing of the tendon. In this condition, abduction is not possible. Here also can see the partial tearing of the supraspinatus tendon. So here it is the rotator cuff tear, that means the supraspinatus tear. And also here you can see this is another muscle, which is the subscapularis, and it also partially torn in this condition. So what is rotator cuff tear? Rotator cuff tear is a common in elderly people. Following a minor trauma. So sometimes they cannot give the proper history that is there in trauma or not, because it is caused by only a minor trauma. And when the tearing is more than 2 cm, in this condition, surgical fixations or surgical repair is required. Length and history of the scenario is suggestive of tear complaining impingement. So what is our option? It is the rotator cuff tear, especially the supraspinatus tendon tear, because here the active attempt of abduction, that means the initiation of the abduction is lost, but there the passive movement is normal. In case of osteoarthritis, there is a pain in case of both active and passive movement, and in this condition, active movement possible. And the metastatic malignancy, adhesive capsulitis, calcific tendinitis, in all conditions there is active movement is possible, active abduction is possible, but there is pain or reduce the movement, but there is active movement is possible.